So, the needs of our bodies evolve throughout our lives. For women, this is especially true. Pregnancy brings unique nutritional demands, and later, menopause presents a new set of physiological changes. But how should these transitions influence the way we eat? Should we adjust our diets to support the natural hormonal shifts we experience? And what about the menstrual cycle? Does our body's monthly rhythm suggest we should be eating differently throughout the month? These questions are more relevant than ever, particularly as the wellness industry continues to grow at a staggering pace. In 2023 alone, the U.S. dietary supplement market was valued at $53.58 billion, contributing to a global market that exceeded $177 billion, according to the Grandview Research and Penn State Health News. Yet despite this massive investments in supplements, research suggests that many of them may offer limited benefit to the average healthy individual. So are we falling victim to brilliant marketing campaigns, or are some of these products truly beneficial for achieving optimal health? The answer isn't, at least in my perspective, one size fits all. While some supplements may be unnecessary or even ineffective for certain people, others can play a crucial role in filling nutritional gaps, especially during times of physiological stress, hormonal change, or recovery. The key is understanding what your body needs at your stage of life and approaching supplementation as just one piece of a broader, individualized wellness strategy. Welcome. This is GynoCurious. I am your host, Dr. Amy Novatt. From both sides of the speculum, we are here to investigate what it means to be a healer and to be healed. Please share the show with others and leave any comments you might have at comments@radiofreerhinecliffe.org. And if you're interested in learning more about my clinical practice, please go to dramynovatt.com to learn what you need to know. So today's guest is Rebecca Blake. Becky has joined us on the show before, so please check out our prior conversation with us. Specifically, it was episode 87, to hear her wisdom about nutrition and dietary fads. And to remind you, she holds a Master's of Science in Clinical Nutrition and Dietetics from NYU and completed a Master's of Science in Healthcare Delivery Leadership at the School of Medicine at Mount Sinai. Becky is a clinical nutrition subject matter expert, speaker, and clinical healthcare operations executive with 18 years of experience across the greater New York City nutrition and healthcare landscape. Welcome, Becky. Thank you so much for joining us again on GynoCurious.
Thank you. Pleasure to be here.
Thank you. So, when you think about giving nutritional advice to women versus men, does the gender of your client affect the way you advise them?
That's a dangerous question. I'm going to get myself into trouble if I answer it. No. Maybe, maybe. And so I would say, is it really the gender, or is it just the concern that make the reason they're seeking nutrition input, right? Or counseling? Is it really about their gender? Or is it just like, well, this person has one situation and the female who is, let's call her 48 or 49 or 54, wants to talk about peri and menopause related nutrition, which maybe her male counterpart wouldn't be interested in that, but which is definitely going to be important for her to learn about if she wants to sustain good health.
Yeah, that was very diplomatic of you. I liked that.
I
Very
try.
well done. So, let me go back a little bit in time in terms of our cyclicity. There is this thing called cycle syncing. Have you heard about it? Where, you eat where you are in your menstrual cycle. Do you have any thoughts about it?
I don't love it.
Okay, can you tell me why? And I will say there's really very little robust science about this, and maybe that's why.
That
What
is
what would you say?
why. So I have to tell you, it strikes me as pretty gimmicky, rather fad-ish, in the sort of woo-woo vein of California style wellness, which not no disparagement meant to my friends and colleagues and whoever else lives in California that might be listening. But this idea of like, Earth Mother getting in touch with what she really needs on that level, I don't see the science that supports it. Even the correlation that people try to draw between this phrase hormonal balance and nutrition is very, very nuanced, and it's not that simple. It's not like, oh, I'm in the luteinizing hormone elevated stage right now, therefore this seed or this nut is going to best support where I am. Like, support how? Like, what are we talking about here? Like, on a molecular level, I don't see the science to show it. It strikes me as a little bit similar to eat for the pregnancy week you're on.
The big one.
Yeah. So that can be a different topic or later, but I don't love it because I don't see the data.
Yeah.
It doesn't make sense to me knowing nutrition science the way I do.
Yeah. The only caveat I would add is that there's no question that women will come into my office and say, Dr. Amy, right before my cycle, all I want to do is eat chocolate and carbs and like, what's this about? Is this
Okay.
hormonal? Is it what's that? How would you respond to that?
I love that question so much because I also working with many, many, many women over the course of my career. This is not a surprise. This is what people say. But I did a very, very extensive research dive into this topic because I wanted to know for myself as well. Although those things aren't coming so often anymore. So what what I
They're
will
long gone
share.
for me.
Right. I mean, whatever. We'll get there soon. So, is that we are, in fact, more metabolically active. That means our basal metabolic rate or our resting metabolic rate. So, just the amount of energy that our body requires just to operate its daily functions, forgetting about activities, sports, walking around, lifting weights, etc., is increased 2 to 3 days before day one of our cycle. That
That's the first
means
day of our period. Hmm.
that is exactly. So now think about this. I'm craving everything. Or I would ask, are you just hungrier? And you're not up regulating your meal size, right? Because you always have your Greek yogurt with your berries and your cereal flakes in the morning, and then you always have an apple before lunch, and then it's a turkey sandwich, and then you go about your day and you're trying to eat the same way that you always eat, and you're not realizing that your body is actually more metabolically active. And my theory is that we are just craving more energy from food. When I say
Mm.
energy, I mean calories, kilocalories. And so, what happens when we lead into those days with just an increase? Maybe it's 100 or 200 calories a day, but maybe it's whole foods. And how does that impact the thing that all we want to do is be on the couch with a bag of chips and Hershey Kisses?
You've been there too, huh?
Yeah.
Yeah, no, that I like that reframing. That makes a lot of sense. Yeah. And to some degree it this is kind of a subtext of how people are eating in general, as you described. If their fallback for getting more energy are chips and chocolate, in contrast to yogurt, fruit, and nuts in
Right.
general, then
Maybe you just need a bigger sandwich, Maybe it's an extra whatever bar if you're into bars, a good bar. We'll talk about that later. But like if maybe it's just a little bit extra, but what if we try to lead in with whole foods? I think is what I say. Because I also think just especially in the weight loss and weight maintenance world that a lot of women are interested in working on, that let's not already be resigned that once a month I always sabotage myself. And I feel like it's a little bit self-fulfilling, right? It's like, oh, but day one's coming, and I know this is the week, and this is going to be a hard week. And it's like you're already there in your mind. I'm not saying people don't have legitimate premenstrual syndrome symptoms, but have we tried just increasing whole foods?
yeah. Would you say or I guess let me pose it a different way. Is there any science around nutrition and fertility and
Yes.
infertility? Can we
Yeah.
talk about that? Because I know you had your own journey with infertility,
Yeah.
which I don't know if you're willing to share or not, but
Yeah.
and how much that may have informed you about this subject.
When I was struggling with fertility, even though I was a registered dietitian at the time, I was not thinking at all about the nutrition component. And to be completely honest, my issue was like not going to be helped much by me changing my diet, mostly because as a dietitian, I was already eating a pretty whole foods based diet. I was in a healthy body weight range, et cetera, et cetera. So I wasn't really inspired to be like, what supplements should I be taking? And it just, there wasn't as much research back then about it. And maybe your endocrinologist had a list that he gave to everyone that basically had unexplained infertility, and they're all relatively established as harmless, but how helpful are they? A lot of the supplements and nutrients that are encouraged, well, let me start with supplements. When we talk about women on a fertility journey, the supplements may look different from men on a fertility journey. So I will call that out, as it's not one size fits all across the genders, but there are some common themes. When it comes to women in fertility, we know that having adequate omega-3 fatty acids in our diet or supplementally is important. We know that a diet that's high in antioxidants is important. But when it comes to supplementation, that has a lot to do more with what is the underlying root cause of sub or infertility.
Could you unpack that a little bit, please?
Yeah. So I'm going to give the case of someone with polycystic ovarian syndrome, PCOS. There is a lot of research around supplementation in polycystic ovarian syndrome, and something called myo-inositol has really been shown clinically to improve ovulation, other factors related to fertility when taken consistently with a diagnosis of PCOS. But taking myo-inositol without PCOS is not going to help you conceive.
And myo-inositol is something that somebody can get over the counter.
You can.
Yep. Yep. Good.
Yeah.
And what about the woman who is having difficulty with let's just think of the unexplained infertility. Is there a kind of regimen that's being recommended? Because that's a big group. That's a big group.
So it is a huge group. So
Yeah.
honestly, the regimen often varies practice to practice. By that point, if you've been diagnosed with unexplained infertility, then we know someone has worked you up on some level. There's no supplement for hormonal balance. There's no supplement that's if you have premature ovarian failure or poor egg quality, right? There are things that some people will say you can do, but the research doesn't necessarily support it. So you'll see everything from CoQ10, because by the way, CoQ10 is an antioxidant. It's not going to hurt you. Is it going to help you? Who knows? It's helpful to give people something to buy and to hope will help when there's the word unexplained in their diagnosis. And so a lot of the supplements that I see being given or recommended during fertility journeys may have a very, very small, statistically significant or brinking on statistically significant improvement rate in fertility, but nothing that people are like taking to the bank.
Yeah, and I want to remind listeners that just because there's a small study investigating, let's say, CoQ10 and fertility, doesn't mean that it is in fact effective in reducing infertility. So you might go into PubMed and all of a sudden you'll see 3 studies on this supplement. Again, the end results do not imply that it's effective. Yeah.
And the other thing I want to tie in there is, how are we eating? So if basically you're taking supplements that are high in antioxidants, well, also, are we eating a good ample supply of antioxidants? Berries, for instance, are like some of the best sources in our diet. So like having a diet that's high in vegetable matter, essentially, that's where we're going to find our antioxidants. So is this someone that's already eating a lot of vegetables, or are they not? So what I see the most impact comes from is when someone is doing things very, very not according to what the health standard would be, or the best fertility practice would be. And then when they really make some meaningful shifts, that's where we may see more benefit. It's just more extreme or more noticeable. Like, we know that if you have polycystic ovarian syndrome and you are also in the kind of typical presentation wherein you may be a little bit, your BMI might be elevated, right? So you have a little bit of pounds to lose, perhaps, that really losing 5 to 10% of your body weight can dramatically improve fertility. And that's where, you hear about the Ozempic babies. It used to be bariatric surgery babies, that we see kind of a boom in fertility after a dramatic weight loss, or even not so dramatic.
So I just want to remind listeners that PCOS or polycystic ovarian syndrome is a syndrome, a collection of signs and symptoms, particularly from a physician point of view or a clinician point of view. It's a triad of small cysts on the ovary seen by ultrasound combined with hirsutism, so hair growth that may be, or androgenization really is the better way of putting it, that you might see chemically on your labs or clinically with more hair growth and or some anovulatory or bleeding dysregulation. And the diagnosis for PCOS has changed over, over the last, 2, 3, 4, 5 decades. But
Mhm,
that's the kind of the current criteria that we look for.
mhm.
Um, and what's true for many, many people, women who present with PCOS, is, as Becky's implying, there's often extra weight, that these individuals tend to be overweight. Not everyone, but many are overweight. And that's part of that androgenization phenomenon. Yeah.
And the ones who are overweight are actually nutritionally easier and more simple to treat, because the weight loss piece is for some reason so effective in the metabolic endocrinological shifts that occur with just a little bit of that weight loss. Whereas in what we call lean PCOS, which is like you don't see the typical hirsutism, you don't see the typical, you might see a little hirsutism, but you don't see sort of that typical android body composition where like it's kind of an extended looking belly. Those are harder to treat in terms of nutrition and supplements.
Yeah.
There is more coming out on iron status and fertility, and vitamin D and fertility. And so one of these questions is like, should everyone just go on all of it?
Mm.
And I really usually say no. Because at some point, first of all, it does matter what is your iron status already. Like, I think it's really important to get a good clinical picture of someone's nutrition status before just throwing a bunch of supplements at someone. So get your iron levels checked before you take an iron supplement because you read a paper saying iron's really important for fertility. Of course it's important. It's all a little important.
Yeah. 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 I think that you've made some really important points that I agree with. One, that it's best to get all of these supplements, nutritional necessities through our foods. Please, that's the best way of maintaining health. And that too, just because somebody studies and asks the question, does vitamin D help with fertility, doesn't mean that vitamin D helps with fertility. So the science has to be robust. You want to look at the results critically. You want to see how many people were studied. If the number of women in the study were five, that is a very, small number.
Yeah.
And that we need thousands in a study to really draw conclusions that are based on scientific study and statistical significance. But maybe there's not enough people asking these questions, or maybe again, the marketing around supplements, which is what I, talked about in my introduction, is just so powerful, and that people are grasping for ways of being healthy, that supplements feels like a good tool. But I guess that's part of a question I have for you is, why do you think why do you think that us humans gravitate towards taking so many supplements and adaptogens in the absence of science the way we do? I mean, billions of dollars worth.
Mhm.
And it's not just because they're expensive. It's because there are millions using them.
I love that question. Do we have 3 hours? But we don't. So I'm going to make this one as pithy as I can because I could write a
Right.
book. It's my favorite topic. The supplement industry is a multi-billion-dollar industry for a number of reasons. Let's just use the fertility market as an example. You have someone who desperately wants children. And maybe it didn't start out desperately. Maybe it started out as, and we're going to wait and we're going to do it when it's the right time. And he finishes law school and I finish med school and then we're going to get pregnant. And it's like, oops, now we're 38 and we're not like, it's not so robust anymore. And my egg reserves aren't great. And I'm hearing all these things, right? And I, I talk to people who are in medical school with this very problem or became doctors later in life. And I'm like, have you seen the science around this? It's not great. It's like, yeah, I know, but whatever, I'll do anything. And so, this idea of yes, whatever, I'll do anything. You have to look at the vulnerability of the population that is seeking the supplements or the treatments or the fad diet or the magical metabolism burner or the testosterone booster. This is no disparagement to the people, to the patients, to the consumers of these products. It is, I need something to help me fix a problem and or a deficit or something that I don't have an answer for. And someone is selling it in a bottle that I can buy. And you know what? Because we're not well trained as a population in how to look at research studies, how to understand study strength and constructs and randomized plus double blinded placebos. And it's a lot of words if you're not a science nerd.
That's right.
And
That's
so
right.
it's like, oh, but for $30 a month, I could maybe get pregnant easier. Sign me up.
Yeah. Listen, we all feel vulnerable in one way or another. It may not be about infertility. It may be about the perimenopause. It may be about the postmenopause. It
Mm,
may be about the stressors in our life. And oh, there's a bottle on the shelf that helps reduce stress. I've tried everything. I've tried everything and nothing's working. So,
yep.
yeah, it's a very human quality. And it's, I feel sad about it only because people are spending more money than they have on these supplements. And I just helped somebody move the other day, actually, and she took out all the stuff in her medicine cabinet and cabinets were, all of her tampons and everything else was. And she had easily $300 or $400 worth of supplements that
Oh, yeah.
were, she had taken one or two tablets
Yep.
or she had only done half of it. And I was like, well, why did you take this? Oh, I don't actually remember. I mean, they've been in their cabinets for years, but I'm
I
sure
don't
it's not
remember
an
what I
unusual.
read or who
I
told me I
know.
should take
That's right.
it. What I see the same thing and it kills me because these products are expensive. So one of the
Yeah.
things I like to do is try to debunk and I talk to a lot of clients who are taking supplements. I always do if I don't know offhand, I always do a literature dive and a lot of people don't remember why they're taking a certain herb or a certain adaptogen or even just something more standard like magnesium, or they don't remember why they were put on vitamin C or they were taking iron. Like there are people who just don't know, and that's okay. But it is something we're putting in our body, and it is something that in the United States we have very, very poor oversight in terms of quality and efficacy and even safety. So the
That's
FDA,
right.
you hopefully the listeners know, but if they don't, they do now. The FDA does not regulate the supplement industry. Like, think about that because think about how
Yep.
much of your social media feed is trying to sell you something. So if you're in menopause or perimenopause, you got a lot of people throwing stuff your way.
Oh, and right now, the cauldron spilling out over all of us around that,
Totally.
it's huge.
And yes, when you're up all night with night sweats, soaking through three different pairs of pajamas and kicking your partner into the guest room and, all of the rest of it, you will spend something to
That's
fix
right.
it. And I can tell you that they're actually not snake oil, but not hugely effective. You may hear about soy isoflavones for
Let's talk
management.
about it.
Yeah, for management of vasomotor symptoms of menopause. Those are the nasty hot flashes, night sweats I just mentioned. Taking about 250 milligrams a day of soy isoflavones. So those are in fact the powerful-ish phytoestrogens, so sort of estrogen adjacent, but the plant version compounds, active compounds that you find in soy, so like tofu, edamame, etc., soy sauce, that they have about at the 250 milligram dosing level, there's about a 20, maybe 30% reported reduction in vasomotor symptoms. So now, if you are someone who has not been cleared to take any kind of hormone therapy, this may be something to try, or for some reason you don't want to take hormone therapy and you want to try, supplementally herbs and things like this first, botanicals, go for it, try it. I will tell you that I've read a lot of studies that actually suggest that Asian women report much less incidence of hot flashes and night sweats than any other population that's been studied. And notably, the Asian diet is like 100 times higher in soy isoflavones than the typical US diet.
That's right.
Coincidence, or they're just not complaining?
Well, yeah. In fact, when I looked at this information years and years ago, there wasn't even a character in their alphabet for like hot flush. Didn't exist. Nobody has been able to say this is cause and effect, but the observation has been just made over and over and over again. And then when Asian women come in the States and their diet changes, guess what? Their vasomotor symptoms go up.
Yup.
So up.
Yes.
So they get more vasomotor symptoms because their diet has, in fact,
Dropped in isoflavones. And so
that's right.
I happen to believe that even if you're only able to support it with a 20 to 30% improvement using supplements, what if you also leaned into a different diet that was higher in seafood than red meat, that was higher in vegetable matter than in simple carb? Now, it's not that the Asian population has a perfect diet either, right? Those certain areas in the blue zones, like outside of Japan, certainly are known for longevity and good health, similar to like the Mediterranean diet outside of Greece and Italy.
Right, right. I just want to speak a little bit more about the isoflavones because
Yeah.
you mentioned the women who may not be able to take hormones. So, particularly women with histories of cancers that are estrogen related. Years and years ago, well, not so long ago, years ago, the recommendation was that those women who had breast cancer histories or ongoing breast cancer should
Mhm.
not eat tofu, should not eat tempeh, should not have any isoflavones. I mean, and women would come into my office like terrified because they
Yeah.
happened to have tofu in a dish they didn't know they had. They were so worried. Thankfully, the science is much improved. And I just want to tell those listening that, first of all, science is suggesting that there may even be a protective effect, that it downregulates, that eating tofu, for example, downregulates the estrogen receptor so that there's less receptors open to estrogen, your natural estrogen, that
Hmm.
may promote cancer. So, again, for those out there who have had breast cancer or any estrogen related cancers, we are no longer saying do not have these products in your diet.
Correct. If anything, we're saying this is a good route for you to pursue if you can't take traditional hormone therapies,
That's
which
right.
we do know are the most effective. If you're just talking about managing menopausal symptoms, you're not a soy isoflavone or a bowl of tofu isn't going to hold a candle to estrogen and progesterone. That is true, but it's not an option for everyone. And so, yes, absolutely has been established as safe not only to eat tofu, but even to supplement with isoflavones.
There you go. So you use the word adaptogens, and I want to make
Yeah.
sure that we mention that. So would you just explain to us what an adaptogen is? And maybe, we'll ride on the wave of the peri and postmenopause right now in terms of adaptogen use or not.
So adaptogens are basically any substance that exists in nature in our natural world that has been found to have some active properties that impact something in our system. And I know that's like that's really basically the definition. I mean, it's
Yeah.
not a super fancy definition, but they're not considered drugs. So they don't utilize like the same metabolic pathways as like I'm going to put out there like cannabis is not an adaptogen. Cannabis is actually in the drug category, right? But someone might argue that like CBD is an adaptogen rather than a drug. I don't know if that is like an actual thing, but I have heard it. I have heard people refer to CBD gummies, which are not regulated. Like you can buy them legally, easily now without a prescription, and you have to put your driver's license down, whatever. So, where we're really seeing them boom right now is the mushroom industry.
Yeah. So
So,
is a mushroom an adaptogen?
yes, but not all. So like the shiitakes and the white buttons and the portobellos you're making in your stir fry tonight are not going to do anything. And they're not adaptogens either. Now, how people know whether a mushroom is an adaptogen or not, that's for a different level of scientist than I am. I will leave it to them. But I will tell you that reishi mushrooms are really one of the best studied and established of the adaptogens in the mushroom category. They are really widely considered quite safe. They were historically known as the mushroom of immortality. Claims are anti-cancer, improved immunity, anti-diabetic, antioxidant, anti-aging, ability to lower cholesterol, and a whole bunch of other things. The active component is something called triterpenes. So you might have heard of terpenes before. It's a carbon, hydrogen, oxygen molecule. The triterpenes, I don't know, there's something with a tri in there. There's a three something in there. It's not super important. But what we see with things that have high levels of triterpenes is that there does seem to be a level of antioxidant and anti-inflammatory benefit.
So is this something, for example, you would recommend to anyone and everyone? How would you suggest that our listeners integrate it or not integrate it into their lives?
So,
Since it sounds like it's so positive.
yeah, I,
And remember, you and I are not developing a relationship with our listeners. We do not have a patient client relationship. We are
right.
just educating. So, everyone who's listening, I want to remind them that we're trying to put out educational
Hmm.
information, but it's not what you necessarily should do as a individual. So, I just wanted to,
Good.
to
Yeah.
say that.
Because,
Yeah.
without the caveats, but
Yeah. And because you mentioned it, so I'm just
I'd say
curious
try it.
how, yeah,
I'd say try
try
it.
it.
So
Yeah.
here's the thing. It has been established as safe. In the world of reishi mushrooms, and the other really interesting adaptogen that I've researched a bunch on is ashwagandha.
Oh,
Um,
yeah.
and that one actually has been used for a long, 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 long time. And
Centuries.
and does have a probably the most robust database of research supporting its use for improved vitality, improved mood, reduced stress. It's been used in India and Asian countries for like literally millennia for like testosterone, improved sexual vitality. I actually decided to just start taking it when I knew I was going to do this episode. Little fun fact. And I noticed that about 30 to 40 minutes after taking, like, literally the Nature's Path delicious blue blackberry, whatever flavor gummy it was, that I got sort of this interesting jolt. Like it
Interesting.
felt neurochemical. And I did it for a whole month. So I am a very bad study construct.
N
I
of
have
one.
I have complete bias. It's myself. I have no other data to share. But I did try it and I'm like, these are kind of delicious and I kind of like how they make me feel. They certainly are not making me feel bad and they're
Yeah.
established as safe.
Yeah. I mean, it's actually something that I talk to women about vis-a-vis treatment for the perimenopause, menopause transition, because women
Yeah.
have been using ashwagandha for, again, a long time for this particular time in their life.
Yeah.
And as you're suggesting, Becky, it's kind of it's kind of a global healer, if you will, and certainly seems to help the body adapt to stress and perhaps create a sense of balance that other
Adaptogens.
adaptogens, yeah,
Like
may
maybe it
not do.
helps you roll with it a little better. I want to just go
Yeah,
on record as saying that technically CBD is not defined as an adaptogen, but it acts like one. So that's why you'll hear people like kind of lump it in there. It does seem to enhance your serotonin receptors. So those are those feel-good neurochemicals. It seems to open them up a little bit, make them more receptive to receiving delightful signals.
yeah, yeah. So when someone comes to your office and they're talking about their supplements and their adaptogens, and usually in my current practice, I have them literally list every single one they're on and the dosage and how long they've been
Yep.
on it. And I must admit, more often than not, I'm telling folks to stop taking them, or the majority of them. And I always get this kind of look of like, really? Really? And I must admit, I feel a little badly because they, again, probably have hundreds of dollars worth of pills at home. First of all, they're often coming with also signs and symptoms of not feeling well. And I'm like,
Hmm.
I can't tell you of these 15 products you're taking, what might be giving you this slight feeling of nausea, or what might be contributing
Yes.
to your constipation, or et cetera, et cetera. So, like,
Yeah.
let's clean up the slate, let's clean up the canvas. And I know it's big ask. It's a very big ask because there's a certain, it's not a physical dependency, but an emotional dependency on taking these products every day. There's a usual routine and ritual around it.
Yes. Safety.
Yeah. And so I guess does this mimic what happens in your office? And how would we speak to those out there who are taking a list of 15
Hmm.
or even three supplements?
Yeah.
What might be the supplements? And remember, supplements, everyone out there, could be vitamins, could be these adaptogens, could be the phytoestrogens. What
Could
ones
be
would you?
protein powders.
Yeah, creatinine
Yeah.
is a big one right now.
Oh, everyone's into
Yeah.
it.
So I guess if you were to tell our listeners, I don't know, how to think about supplements and how they take them in their
Hmm.
lives, what
Yeah.
would be kind of the psychology or the philosophy? You've intuited, I mean, you've implied it already, but if you were to kind of
Yeah.
speak to it, yeah,
I do it almost every day. I'd say because of the way I practice, I really feel it's, I mean, I may be a little snarky on the podcast, but in real life, I think, no, I don't think, I know that I am incredibly empathic and I always lead with a no guilt, no shame, no judgment. But what are we taking? Right?
yeah,
And we've got to do a deep dive. And everyone also knows that I'm a super science nerd, from just starting to work with me. I make that clear. I'm going to try to make it relatable and understandable, but I love data. And first of all, let's understand one thing about not just the supplement industry, but medications, any controlled substance, anything that has impact on our body, right? Is that it doesn't just target the one organ system or the one thing you're trying to treat in a vacuum. So, like you said, why am I nauseous all the time? It's like, well, what are we taking? Right. And I actually recently had a client that last week who's taking Lunesta and who is walking around very, very nauseous with very little appetite and is very concerned about what's going on. And so I am apparently the first practitioner she has ever worked with that did a deep dive into her daily chronic nausea. And by the way, it only happens the days after she's taken a Lunesta. But because I also have people keep some very rigorous food diaries, if we're trying to figure out like an intolerance, which is what she thought she had was some sort of food intolerance, it's the Lunesta. So great, it's helping you sleep, but it's also making you feel sick to your stomach. Enter CBD. I don't know, maybe. But I guess what I would say is there's no guilt and no shame that you bought these things, that you know, bought the snake oil, right? Because it was sold to you at a time where you were looking for answers to solve something. But now we've got polypharmacy going on here. Now we have just too many substances in your body to know their impact. And like, unless we're treating a vitamin D deficiency and we know we've got a D or maybe hopefully a D plus vitamin K, which is shown to help utilization of D, or you're on iron or you're on something that's like medically established that you need, let's get rid of the extra stuff that we're like, I don't know why I'm taking elderberry. I don't know why I'm taking this one.
right. Yeah. So vitamin D, I'm glad you brought that up. It's certainly a very popular conversation in our peri and postmenopausal women
Yeah.
for bone health. We talk about calcium. We used to recommend calcium across the board. Now we're not. We want
Yep.
you to get calcium through your diet as best as possible. If you realize you don't have any calcium in your diet or very little, then yes, we will recommend a supplement. But otherwise, there's science to demonstrate it can increase the risk of kidney stones and even heart disease. So
Yep.
we want you to get it through your nutrition. And again, as Becky's pointing out, unless a clinician has pointed out that your blood work, some testing has demonstrated a deficiency, then uh, be
More
mindful.
isn't always better, just like in life.
Hallelujah. Yep,
It's just not always better. So I've got people that are like, yeah, but so I take extra ones of these. I'm like, nah, don't be taking extra ones.
that's right. And remember, some of these vitamins, for example, are fat soluble. So they stay
Yes.
in your body. And there are toxicity levels to even vitamins. Everything has its shadow, everything has its
Correct.
risk.
And
Yeah.
so I'm going to put a plug in because it wouldn't be an episode if I didn't. This is why there are doctors and registered dietitians. And no, not all doctors are well trained in supplements. Many of them are not. Most of them don't know much about nutrition. No offense. It's not part of
No,
the
it's true.
curriculum. So the
That's
ones
true.
that know a lot about it have made it their own work to learn, to become a lifelong learner of nutrition. If they're
Right.
interested, but who has time for that? The
Right.
suggestion that doctors should learn more about nutrition, which maybe just came out as a new thought from Washington, D.C., is I would say rather than doctors knowing more about nutrition, doctors should be collaborating more with trained professionals like registered dietitians who do, and that the care should be more integrated. But yes, more isn't better, and everything that goes in isn't just impacting the thing you want it to impact.
Right. I like that you pointed that out, that just because you take, I don't know, calcium for your bones, for example,
Right.
guess what? Calcium can be extremely constipating. We know this. It's thereby clearly affecting your gastrointestinal system, maybe your
Mm-hmm.
microbiome, all this stuff. So it's got nothing to do with your bones.
Yep.
So it is a little bit like throwing a dart at a dartboard. You're not, you just don't know
But
exactly where it's going to land.
someone like a dietitian would take, a nice sample size of what your typical intake looks like. You're eating yogurt, you're eating cottage cheese, you're drinking milk, you put a splash in your coffee, or you're a vegan, or you hate milk and now everything is oat milk or almond milk. So someone like me could say, okay, you're probably getting like maybe 300 milligrams of calcium a day, and your daily recommended intake is 1200. That's a big gap. Right. And if we see a big gap, it of course behooves you to compensate for the gap. But don't just assume you've got a gap if you don't really know. There are other things. There's vegetables that have some calcium content, especially if they're in the earth for a lot of time, and small bony fish. So if you're eating sardines, you might be getting a lot of calcium and not know it.
Yeah. 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 Great. Great. So do you think there's anything more than what we've discussed that people should absolutely know about how to integrate or not integrate supplements into their world, particularly as women in terms of our cyclicity and hormonal milieus, which is, constantly changing. Can you speak to that a bit, please?
Yeah, I think I'd start with what is the problem? It
Yeah.
sounds really simple.
Yeah.
Like, what are we trying to treat? Because a lot of times what I hear is energy. So people will say, I don't have enough energy. And so guess what? And I bet Amy's going to nail it. What am I going to ask them?
What do you do during the course of your day that you don't have enough energy?
Maybe. I
How many
usually
things? And what about sleep? How are
bingo.
you sleeping?
Nailed it. Nailed it. So I'm always going to say, huh, interesting. How much sleep do you get average? Do you think even one of the people that have complained about low energy to me in the last literal 2 decades of practice has almost ever said I get 7+ hours of sleep a night?
Or 7 uninterrupted hours of sleep a
And
night
that's
because
the other
I'm
thing, not just in
flushing every
bed
two
for
hours. That's
right.
right.
Not
That's
just in
right.
bed for 7.
Right.
But so I really think it's like because we again, social media, influence from external parties, everything we've been really well taught to not listen to our own internal wisdom. And so what I really endeavor to do with folks is what are you feeling that we're trying to correct? And let's go to the least common denominator. What is like the thing is you don't have a lot of energy and you're consistently getting 5 to 6 hours of sleep a night max. Oh, but that's all I need. You just said you have no energy. That isn't all
Yeah.
you need. Right? Let's
Yeah.
start there. We may need no vitamins. We may need no supplements at all. We may just need an 80% of the time whole foods based diet with a lot of fun and some good sleep.
Yeah. Yeah. Boy, we have this proclivity of making everything so fucking complicated.
You're so
It's,
good at it. And
we're
guess what?
so good
You
at it.
don't make money if you don't sell the supplement. So it
Yeah.
just does go back to when you said, is this just really good marketing? Yeah. It's
Yeah.
especially now, as soon as you search fertility, you now have on your Instagram 50 prenatal vitamins coming up.
Yeah, same with menopause. So, I hate to say it, but there are some really wise women out there who are talking about menopause and perimenopause on
Mhm.
Instagram and all the social media platforms, and they're smart women.
Yep.
But I have a problem with those who are also profiting by selling supplements that are
Thank
under their
you.
name.
Which is
I,
why
I
you,
just,
yep.
yeah, and this is the American College of OBGYN is really clear about this, that we should not be selling products. I have no problem telling my patients about products that I've researched and that they might go to the store to consider and compare and contrast, but I don't sell them. I don't sell them.
I get very uncomfortable with that very thing. It is against the code of ethics that I have agreed to as a registered
Yeah.
dietitian to sell supplements. Again, I am not deliberately saying anything negative about other nutrition practitioners who are not registered dietitians, but who are in the more functional and holistic space. But I really feel like you've got to have some very serious integrity around why are you selling this? What is your evidence base that this is going to be helpful for someone? And how much are you capitalizing on it? Because to me, it is a conflict of interest.
I agree. I agree. Yeah. It's not that we're not here to help direct. That's part of our relationship with patients. But you can then say, okay, you need calcium. Let me tell you about several sources of calcium, places where you can buy it, how to think about it, the different calcium salts, and
And
educate people.
And here are some good supplement brands. And what I want to say
Right.
about
Yep.
supplement brands are there are
Please.
two good governing bodies that are not the FDA, but they are third party, like audit type companies that will put their seal of approval on certain supplement brands.
Ooh,
Uh,
what are they?
so one is called NSF,
Mm-hmm.
like Nancy Solomon Frank, and
Mm-hmm.
one is called USP. NSF is the National Sanitation Foundation. And you will see their seal of approval on a number of pretty popular supplement brands. But again, now that the industry is so overrun, it's hard to know what's being overseen, what's not being overseen. They look trusting. They've got a doctor saying that they would buy them. USP is US Pharmacopoeia, is what it stands for. So you should look, I recommend if you are not sure and you want a supplement of high quality that does have some standard of someone's going to check our manufacturing, our facility from time to time, make sure that the things we're selling are what we say they are. Look for either of those.
Great. Well, that's very helpful. Very helpful.
Yeah.
All right, we are coming to a close. Is there anything else that you feel like we forgot to say or that you want to leave with our listeners?
Not, I mean, I think we hit all of the high level. Yeah.
Great.
I mean, there's really
Great.
nothing to add except it's a fascinating space, and I encourage people to really lead with inquisitiveness and curiosity rather than, sure, I'll try anything.
Love it. That's a great last line. Like, just be thoughtful about what you're putting in your mouth.
Absolutely.
Yeah. Becky, thanks so much for joining me again on GynoCurious.
You're so welcome. Thanks for having me, Amy. Appreciate it.
And thank you also to my co-producers, Maddie Rosenberg and Jen Hammoud, and to David Hoffman, my editor. Also, thank you to the Epicurean who continues to host us here in Rhine Clifton, New York. Please come and shop here. It's a fantastic little store. And until the next episode, please be well. Listen to your instincts and intuitions. They are the greatest of teachers not to be ignored. I also want to remind listeners that this podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The information on this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they have and should seek the assistance of their healthcare professionals for any such conditions. Thank you for joining us today.